Okay, I'm really excited. I love it when you come on the show because, okay, first of all, looking your best and maintaining healthy skin, it is not easy and especially not cheap, right? Well, you're about to get the inside track on over-the-counter products that actually do work. And you're going to get it from a man whose job it is to keep women looking young and beautiful. Now, he is an elite expert in the field of plastic surgery, Dr. Gary Motykie. Dr. G! Hello, my Gary!
How are you?
Good, good.
So, when I first met Gary, I fell in love with him because he was always about alternative, always about healthy, always about natural ways to look young and be healthy, and just common sense. So what is the key to looking young with our skin?
Well, I like to tell everybody in the first place, remember, that people don't know, but the skin is the biggest organ in the human body.
I know.
And for that reason, the first thing that's going to make you look younger is being healthy. So first of all, you want to make sure that you're eating right, you're getting hydrated, because that's going to make a difference with your skin.
Right.
When somebody's not feeling well, you say, you don't look well. And you say, why don't you look well? Because your skin doesn't look well, right? Pale or sick.
Right.
So number one, be healthy. Then your skin's going to look younger. Secondly, our skin is different on different parts of our body. Our skin is different on our knees or feet or our face.
I don't want to talk about it.
And the problem is the skin in our face, although it allows its expression, is very thin, so it's going to show aging first.
The
right?
face?
Right. So when it ages, what happens? It loses thickness. When it loses thickness or collagen, you show wrinkles. And then secondly, as we age, our skin doesn't turn over faster. It slows down. So in our 20s, it turns over every 20 days. Our 30s, every 30 days. 40s, every 40 days. That's going to lead to a dull look or to not
I'm
as
getting
bright look.
depressed.
Well, the good news is I have some answers for you.
I want those
Okay.
answers.
And
Do products actually work?
there are some products that actually work, and they're effective. And secondly, the main thing I want to tell people about that is there's no genie in a bottle, okay?
Yeah.
There isn't a magic solution, but there is things that work depending on your skin type and depending on what you're doing. They will make you look
Okay,
younger.
do you not love honesty? I love honesty. Okay, so are you going to show us some of those products?
I
or-
am. I'd like to show them to you right now if we can.
Should we go over here? All right, come on. Walk this way.
You want to see over here first? Okay, well, yeah. Come over here.
All right, so where do we start here?
So over here we have something called DMAE,
Okay.
which is a short word for dimethylaminoethanol. But what it is actually something that firms the skin from the outside. So we're going to put it on your skin, and it's going to help firm and tighten your skin.
Okay, so it's an exterior thing that
Right.
actually firms the skin
It
and
helps
works.
firm the skin. It's scientifically proven. They don't know the exact mechanism, which sounds weird, but it actually works. So it's
Isn't
something.
that crazy?
It's not actually.
So
that
what
crazy.
does something like this run?
Something like this is going to depend. You can pay anywhere probably between $80 to $100 for a kit like this.
When do you start seeing results, Gary?
It happens right away. As soon as you put it on, you're going to see some firming effects right away.
And it's healthy and it doesn't ruin your skin
it
or
doesn't
anything?
ruin your skin. No side
Good.
effects.
Because sometimes you can put a lot of stuff on it, just blocks it and makes it worse, right?
Well, the point of, remember, there's 4 things you want to do with your skin every day. One of them is cleanse, one of them is exfoliate, the other is moisturize, and then third, protection, sunscreen. And if you use any of these products and you don't exfoliate, they're not going to get into your skin because
Right.
they're working from the outside in,
Okay.
not from the inside out.
So what is this one here?
This one is called hyaluronic acid, and what that is kind of what I call the sponge in our tissue, all right? So we have collagen and hyaluronic acid, and what that does is plump our skin up. As we wrinkle on our thin skins, we want to plump it back up. It's going to decrease our wrinkling.
Not to be used on your buttocks.
Right.
And how long does it plump you for?
These are things you have to apply daily.
So-
okay? So there's other things we're going to talk about later. They're not, but these we apply daily.
Sounds like a song. Plump.
Right?
Okay, here we go.
Over here we have something called argireline. Now what this is... Argireline.
Argireline.
Don't say it fast. It's really hard.
Exactly, Gary.
And
Okay.
what this is kind of like a topical Botox. What it does is weaken the muscles slightly so that you have less wrinkling, just like Botox. Problem is you got to keep applying it, but it is something that does help with fine lines around the eyes particularly, because that's our thinnest skin around our eyes.
So it keeps the muscle from...
Right. It temporarily helps by interfering with the signal pathway. It helps the muscles relax.
Can I
and
put
get
this
less
on
wrinkling.
Donnie's mouth? No.
You need a lot. I'm just kidding.
And what is
even.
this?
This is something called Matrixyl. And what Matrixyl is something that stimulates collagen inside your skin. So when you put it on, it's going to double collagen production. And remember, we lose collagen 1% every year, okay? So what this is going to do is help stimulate the collagen. Again, thickness, less wrinkling.
Okay, I
pumping
want
of the
that.
skin.
How much is that?
It depends on what we're looking at, but somewhere in the range. These are not very expensive, by the way. Somewhere between $60 $40 to $60 for
Seriously?
different. One of them's for the eye, one of them's for the face.
Okay, that's awesome. Okay. See, he brings great stuff. Okay, what is this?
These products contain something called retinol. You might have all heard of retinol.
Yeah, I was going to ask you. You know, it's been around forever. Is it good?
It is good. It's actually a derivative of vitamin A. So what it is this stimulates, remember I said that cell turnover slows down, right, as we age? And this speeds it back up. So what you're doing with this, applying it, you're speeding your cell turnover back up, and your skin's going to look refreshed and younger.
I love that. Okay, so now you brought a model with us, right?
Well, model and a patient.
And you said now if you want bigger results, then this is when you go see Dr. G. Okay, here we go. What is this now?
Now, if we want to do something by putting something, these are all dealing with artificial fillers and topicals. We want to use our own body. We can actually withdraw our own blood, get growth factors, and get serum from our blood and inject it back into the face.
Shut up. So now, what is your name?
Tatiana.
Tatiana, how are you? And you are?
I'm Dr. Power.
How are you? Oh, I won't touch you.
I apologize. Nice to meet you.
So we're going to show, Dr. Power is going to show you how you inject this, and basically you can come into the office, they draw some blood, spin it down, and then re-inject it into some fine lines.
Does that hurt, Tatiana?
Just a little prick.
Really? You don't feel it any more than that? You're lying.
You can
don't
also
talk.
numb it slightly. And secondly, by the way, this is something that lasts a long time. This is not an artificial filler that's going to dissolve.
Now
it
wait,
stimulates
so
your own
what
cells.
this is doing is it's stimulating her own cells.
Correct.
To grow so the lines don't form?
What it is in our blood, like when you have a scab, when you scrape your knee, that little yellow stuff that comes out, is in it is platelets and growth factors that help your body heal. We're actually injecting that back in with the filler, and what that's going to do is...
Platelets and growth factors.
Right.
So is this expensive?
This probably will cost somewhere between $1,500 to $2,000, but it lasts for a long time. Remember, we're putting living tissue back in.
So literally, do the cells know what they're doing? I mean, are they smart enough to know not to form like massive lumps?
It's actually an interesting question. But this is not a stem cell, but this is a growth factor. So what it's going to do is stimulate anywhere where you have a slight injury or stimulate growth within the tissues themselves, but it won't promote.
So if the skin is dying, it will stimulate the skin to regenerate.
Correct. So if you were to do this, say, in combination with a facelift or a combination with fat grafting, you'll have a more effect because you have somewhere that is being stimulated by the growth factors themselves.
So see how one side, look at the difference, the lines here and the lines here.
There'll
That's
be an immediate effect.
Crazy. Immediate effect, huh?
And there'll be a long effect that lasts longer as the growth factors work. This is an immediate effect, and then there'll be a more long-term effect later on.
Dr. G, the best. Come on. For more information about Dr. Motykie, go to our show website. And thank you so much for being here. Oh, I guess I can shake your hand now. And thank you for being here, Tatiana, too. Seriously. We will be right back. Always on Marie. Interesting stuff.